Wells Fargo is a proud partner of Valley Works, working together to achieve great things for our community.
This is the way it goes for Nurse Leslie Jones most days of the week.
Open up for me, say ah.
Jones is a family nurse practitioner and sees dozens of patients a day at the Community Health Center, a clinic located in downtown Fresno.
Oh, I love it. And you either do walk-ins or you do scheduled patients.
She has so many patients to see that the few minutes Jones took out of her day to talk with us causes a stir, and she has to rush to get back to her work. It is an indication of the vital role nurse practitioners play in today's medical field.
A nurse practitioner can serve as a patient's primary care provider, which is extremely rewarding to the nurse.
You can develop relationships with them. You get to work on educating and hopefully helping them to develop healthy habits that may keep them out of the hospital, may help them to take better care of themselves, and I think there's nothing better.
Many nurse practitioners are like Jones. She is a registered nurse who worked at a hospital, then went on to get additional training. Today, Fresno State and the University of Phoenix both offer the master's degree in nursing that is now required. Tammy Maynard, Director of Academic Affairs for Phoenix, says to take it a step further and become a family nurse practitioner, even more education is required. And here's why.
They can work independently. They can work as consultants with physicians, which is often the case, and they can also prescribe medications.
Neurologically, everything looks really good.
While nurse practitioners are not doctors, they work very closely with them, and their expertise can free the doctor up to see more patients. Maynard says the role of nurse practitioners and physician's assistants will become even more important as the new healthcare law is implemented.
We can expect that the demand for healthcare professionals will increase because the access to healthcare will become more readily available to consumers.
She says now is the time for those considering jobs in healthcare to get the education and training they need so they will be ready to jump into jobs that not only pay very well, but are considered to be very rewarding.
I don't think I would have stayed in nursing had I not become a nurse practitioner, and I don't think there's anything that's more fulfilling or more wonderful than working with people. We're paying when I check this side.